Hi, Like the Way family. Thank you for joining us. I am here with Corin Huff, a dear friend of mine, and today we're going to talk about breast cancer awareness. If you don't know, October is Breast Cancer Awareness Month, and we have someone special that is here that is going to talk to us about breast cancer, her journey, and how her mental health was affected throughout this whole journey. So, Corinne, thank you for joining us. And let's talk. Let's see. How is your breast cancer journey for you?
Hi, Erica. Thanks for having me. So, at age of 43, which is still considered young in breast cancer terms, I was diagnosed with breast cancer. I actually, as much as Breast Cancer Awareness Month focuses a lot on mammograms, which are an amazing tool and very, very important. Mine was a type that actually, a very rare type that sprung up in between mammograms. So I had had my mammogram, and before I was due for my next one, felt a lump and figured it was a cyst. I have cystic tendencies in the rest of my body and figured it was something like that, but went to my gynecologist anyway, who also thought it was probably a cyst for different reasons, and went and all of a sudden found that not only was it cancerous, but it had also spread into a nearby lymph node in my armpit. So then everything really escalated very quickly, not only because of how quickly it had grown to that point. My oncologist looked back at the last mammogram; it definitely wasn't there. So it was a very quick. I had no family history whatsoever. Went through genetic testing, still confirmed there was no genetic component to it. So, all that to say, it really can happen to anyone. And when they say 1 in 8, I never thought I'd be one of that 1 in 8. But the geneticist said to me, even if you look at 8 women in your family and you're the 1 in 8 that had it, it's that prevalent. And I feel, and I'm sure that most of your viewers feel that, you hear it more and more as you get older, as early detection is becoming much more common, and just a more of awareness, maybe more people being willing to talk about it in ways like this. So unfortunately, I didn't have much of a choice in what type of treatment. It was the HER2 form of breast cancer. So there was only really one type of chemo that you would get for that. So, had a great care team who really led me through the whole thing, but I really didn't have a choice but to do the chemo surgery to remove the tumor. I did have some decision in terms of what type of surgery I'd want to get, and then radiation after that. So how it was explained to me was that chemo, it was curative, hopefully curative, and then the surgery would be to remove whatever was left and to see if there was any more evidence of disease, and then the radiation was to kill any other possible chance of it. Of anything else that they might have missed. Now, of course, nothing's guaranteed, but through all of my treatment, I think I got my recurrence rate down to about 2%. So where we have come, I mean, even 10 years ago, they did not have the treatment that I received. So feeling very thankful, feeling very blessed, despite the surprise, despite how difficult it was, to really have the medical tools at our disposal to have a cure that someone 10 years ago might not have had. So I'll let you ask some questions, but that's pretty much the story of how it went down on a very high level.
I know for you, you have your faith, you have your family, your support system. How important was your support system, your church community, in this journey for you?
Yeah. So actually, the way God worked it out was we moved into our new house. We bought a new house and moved about exactly 2 weeks before I was diagnosed. And we often, are in awe of that timing, because had I felt that lump earlier, we probably wouldn't have moved. We would have put that on hold. But where it landed us was right in the heart of, 3 minutes from our church family, 3 minutes from my children's school, and the support, their Christian school, and the support that we had through families and friends there. So God really knew and planted me in right in the middle of that support circle, as things started to escalate very quickly. So I also had, of course, family. I come from a large family, but it was crucial. It was crucial. I mean, my faith in God was what brought me through the most. I mean, I am not normally a person who doesn't worry and who kind of takes things in stride. I do struggle with worry, and I do struggle with control and wanting to have a plan and act on it. So God really removed a lot of those desires. Partly, I think, because there really wasn't anything I could do. I mean, the only thing I really could do was go through the treatment, but it wasn't something where, I really had a choice but to let go and let God. But yet I did have a lot of nurses and doctors say to me, you know, wow, you're handling this so well. And that's no credit to myself, but all glory to God, because that would not have been my normal. If one of my children was going through this, if one of my sisters, I hate to say it, but I probably would have been a basket case. So God just really gave me a lot of grace and a lot of strength to go through that. And then, of course, just being willing to accept the help that people around me were offering. People don't offer if they don't mean it, for the most part. People say, let me know if I can do anything. And for the most part, they mean it. And as much as out of control I felt things were, I think other people also felt out of control, out of, how can I help this person? I want to be able to help this person who has, helped me. I serve in a lot of ways that serve other people, and it's different to be the one asking and receiving. But it's one of the crucial things that definitely got me through. And I've also had a lot of experience with therapy, just different mental health challenges that I've faced, that my son has faced. And I think God has even used that really to prepare me to be able to deal with something like this on a more stable basis.
Okay, great. So we do hear, the statistics of women with breast cancer, like 1 in 4 will experience depression, anxiety, or anything like that. Um, did you feel yourself being depressed or feeling like having depressive symptoms? Because I know the changes with your body, the treatment, and everything can also mimic those symptoms and exacerbate those symptoms if you didn't have to deal with depression before.
Right, right. So I have dealt with depression before, so it was something that I was treating anyway. But yes, this is a completely different form. You are so tired.
Mhm.
You feel. I think the one area that I might have felt maybe the depression creeping in a little bit is, I'm the type of person that likes to be useful, right? I like to be productive, and to not be able to be, in my mind, useful as a mother, right? My kids were 11 and 14 at the time. So still somewhat dependent on me for a lot of things. And to not be able to do the things that I would normally do for them. I remember after my first chemo cycle feeling better, and they warned me, you'll feel better, but you still can't push it. And I was like, I am done with not being here for my family. I'm going to cook like a normal dinner like I normally would. And I got about halfway through, and my poor husband had to figure out like where I left up, because I just couldn't do it. And so that was probably the hardest and most frustrating part, was just not being able to function in the way that you normally do. And we women, we play so many roles, and we wear so many hats, and we are the support system for so many of the people in our lives and our families and our friend groups. And that was probably the hardest for me. And that could be frustrating and demanding. The one thing that I did continue to do, and I was able to do, was work. Believe it or not, I'm in marketing, and my company was, obviously willing to let me work from home. And it was a type of job that I could do from home. And for me, just having even that part, yes, I need to stop for naps. I need to sometimes call out. But for the most part, still having that kind of sense of, I'm contributing to something. And I don't know what that looks like for other people in jobs like a teacher or a
Mhm.
nurse, where you can't be doing that, but just somehow feeling like, you are somehow contributing, or having enough grace with yourself to say, it's okay. This season of my life, I need to receive and not contribute. But for me, even work became kind of a blessing in that way.
One thing I remember you saying is that they had you on this exercise program where they were like a trial to see how exercise affects your healing process and helps you with the symptoms associated with the treatment. How was that for you? Do you really think that that was something that helped you?
I do. So when I first started with my treatment plan, there was a clinical study going on at the hospital that I was being treated in, and they said, "Would you?" They were looking for specific ages and medical histories, and I fell into the category that they offered for me to take part in this. So, I think it was the same recommendation of 105 minutes a week of some form of exercise. That could be walking. They set me up with a personal trainer to do some cardio type things, and depending on where I was in my cycle, whether it was the beginning, middle, or end, I had various ability to be able to do a lot. But if nothing else, just walking, around the block or taking the dogs on a walk. And, you know, it wasn't that it got rid of all the symptoms, of course, but I truly do believe that um, it alleviated some of the symptoms, particularly as they got cumulative as I went along. I didn't feel that what I was warned about as far as the cumulative effects. So yes, you're really tired and sick right now. How tired and sick you're going to feel in your 8th cycle of chemo is going to be so much worse. And I just didn't feel that it became so as worse as they said it was going to be. And I really do attribute a lot of that, a lot of the ability to be able to still focus on work and the ability to have the energy to walk around the block, I think was because I didn't just lay in bed. And I think a lot of people have every good reason to. You feel awful. I really had to push myself. It wasn't something that I wanted to do. The gym was never my favorite happy place like it is for some people. And,
Mhm.
but once I committed to doing that clinical study, it kept me honest to do it. And my husband also, did it with me. And I do believe, and I think the science is starting to show or already shows that keeping active and keeping up some form of physical activity is hugely beneficial to your treatment and how you feel mentally and physically.
Yeah, I mean, they say like exercise is great for, when you're dealing with anxiety and depression, and that it really helps. So I could imagine that some of the symptoms from the treatment, the lack of energy and everything like that, like that your sleep disturbances, the way that you're eating, that kind of mimics some of the symptoms of depression and anxiety. So I could see how that can help manage the symptoms of the treatment.
True. Yeah, that is true. I mean, aside from the chemo side effects, there
Mhm,
is that mental benefit and there is that physical benefit to anyone. But I think the old science kind of said, no, you should rest. You
mhm,
should give your body full rest and let
mhm,
it just recover, which is true. I mean, you do need to be patient with yourself. And, there were times that I couldn't make it up. We moved to North Hilton. It's, it's so many hills, and I couldn't do certain blocks. And it was frustrating, but you have to, be realistic about what you can do. But, if at all possible, find what you can do. And they had set me up with an app, I think it was the Peloton app, where, find which exercise you feel you can do that day. And really it's probably a good, rule of thumb to carry with us throughout our lives as
mhm,
exercise is such a crucial part to our health in general. Do what you can,
mhm.
do what you feel your body is able to do.
Yeah. Now, the after, how are you doing now after? How's, your checkups? How are you managing the anxiety with every checkup that you have to go to? And how's that going?
It's funny because there's actually a support group through the hospital, and I did a little bit of the support group during my treatment, but there's also a whole separate support group for post treatment, and I think that's how significant that part of your life is post treatment, not only because of all the trauma you went through, which fortunately there's some great organizations that offer even free therapy. I got some free therapy through cancer care. There are some other organizations like that, the social workers through the hospital, like anyone going through this journey, there are resources available. But that post stage is so interesting because I almost cried a little bit the last time I saw my oncologist for like a regular visit. I mean, I still see her like every three, it started out as every 3 months, every six, but you're so used to people looking at you and telling you that everything looks okay. And when you stop getting seen, I mean, I personally opted for a double mastectomy, so I no longer even get mammograms because I no longer have breast tissue there. So I'm not even getting that annual report looking and saying, okay, looks good. Now that mastectomy also came with a very low recurrence rate, which is why I chose it. So I think partly the low recurrence rate is helping me post therapy, knowing that I did everything I could. But my faith really is what gets me through. I'm not really struggling post. I've actually moved away from the support groups because sometimes it can actually, as much as you want to be a help to other people, sometimes it's hard, that constant reminder of what you went through. And looking forward, my oncologist once said to me, if you're looking forward, you're not really even thinking about those kind of groups or those kind of needs, because you are moving forward with your life and thinking, okay, God cured me of this, right? And if he chooses to have me walk down that road again, that is part of his plan. But I did everything I could in my human power, to follow his direction and to, cut out things in my lifestyle and foods and maybe exercise more and different things. And, that has to be enough at some point, if you really do believe in an all powerful God who has this in his hands. So, there's a lot of reasons why people struggle. And for whatever reason, I don't have that struggle. I struggled a little bit more in the beginning and through it all. But I also know that some people don't have the blessing of that lower recurrence rate, or, there was something recently where I had a cough that just would not go away for months. And I had my regular oncologist appointment, and I thought, I probably should mention this to her. I mean, nothing is the same after cancer, because you never thought you'd get that cancer diagnosis either. So you can no longer ignore things and think, I'm sure they're nothing, because you already had that experience that you thought something was nothing, and it was something. So, mentioned it to her, and she said, you know what, for peace of mind, let's send you to a CAT scan. And sure enough, something showed up on a spot showed up on my CAT scan. And she said, there is, that association between lung cancer and breast cancer. It's so close in your body, right? It does happen. So we went one step farther and did the PET scan, which didn't happen for probably a good 3 weeks. So, I could have chosen to stress during those 3 weeks, but, when God has gotten you so far, when you're a believer and God has gotten you so far through something, it really changes the way you look at things, right? And you see his goodness in things that aren't good. I often say, had I not experienced that valley, I wouldn't have known the depths of God's goodness, because I wouldn't have I wouldn't have felt the need to be looking for it, if I'm explaining myself correctly. So, like the Bible says, count it all joy when you go through these struggles, because you are going to experience a goodness and a peace and in my case, thank the Lord, a healing that you never would have experienced before. And so it has changed my faith, and it has changed my tendencies to worry, because I can look back, right, on what he brought me through, and times during those periods where things could have been much worse, and he miraculously in some cases made things better. So fast forwarding to the PET scan, and praise God, it was nothing. It was just an inflammation caused by the infection, or whatever infection I had. But it's never going to be something where it's 100% not a part of me, right? This is always kind of a part of me, but it's what you choose to dwell in. I know at the beginning I struggled a lot with, like, I don't want this to be part of my identity. I don't want to be seen as a breast cancer, at that point, patient, and now even a survivor. I mean, I guess so, but it was never something that you think about being part of your story. So I really struggled with that. And, the Lord just spoke to me and said, your identity is in Christ, right? You are a child of the one true King. Like, you are not if you're going to focus on even just being a mom, a friend, a daughter, above that, you're never going to find your ultimate fulfillment in that. So, I really don't dwell on it that much. There was recently, I'm not allowed to have certain things on one side of my body, like blood pressure taken, or injections, or any kind of blood drawn, because that was where the lymph node involvement was. And for the first time the other day, I went for a shot or something, and I forgot which side it was. She asked me which side she was allowed to, do, and I had to think about it. And I praised God in that moment, because it was, such evidence of how far I've come out of it. So for me, but I continue therapy. I do. I still see my therapist regularly. but it's kind of evolved away from the breast cancer and more into, just life is hard. Breast cancer is hard, but so is divorce, and so is work, and so are special needs, children,
Mhm.
and all of these things. We all have a hard, right? And people look, I think, sometimes at breast cancer patients and think, wow, you have, come through so much. And we do go through a lot, but I don't think my pain is any more greater than someone else's. It's just in a different form. Um, treating your mental health, don't wait for something traumatic like this to happen. Like, we all can benefit from understanding why we're feeling certain ways, being validated in those feelings, but also directed in a way to channel them appropriately and not let them become who you are.
I love everything that you're saying, and I'm like holding back tears here.
Oh,
because, because I love you. So it's just, seeing how far you've come and the way that you're talking. And like, if you were to give tips to someone that is beginning this journey, from what I'm hearing from you is, one, you've already had a foundation of faith and taking care of your mental health
yes.
that helped you get through such a difficult time. And it shows how important it is for that self-care and those aspects of your life, and knowing who you are in Christ, knowing um the parts where you need help in, and that was in your mental health, and you really had that foundation, so that when you did go through a hard time, it wasn't like it was easy, but it was helpful. It was a
Yes.
tool that you had, resources that you already had that you can draw from.
Right. That's right. And I would say too, in terms of like help and people offering to help, it's very important if you're starting off too, is just to really trust your inner voice and really trust your instincts for yourself. Because I know, especially like in these support groups, where as great as they are, you hear a lot of different opinions, and you do have decisions that you have to make through the course of your journey. And you can hear a lot of people telling you, what they think you should do. And, just on a very superficial level, cold capping. Do you want to cold cap during your treatment, or do you want to do like I did? And I went the route of losing my hair and wearing a wig, and that was my choice. Someone else might choose differently. I had the choice of doing everything from a lumpectomy to a double mastectomy. That's a huge difference,
Mhm.
right? And some people would probably question my going that far, if I could have done a much less invasive type surgery. But at the end of the day, the right answer is the one that is right for you. And people can give you their opinions. And outside of medical professionals, that obviously I held their opinion, above all else, and prayed that the Lord was leading me to the right care professionals for all of the other decisions. And even when you want to accept help, and when you don't, there were days that people wanted to come visit, and I said, I can't today. And normal Corin would worry so much about that, and so much
Mhm.
about what that person would feel. But, other days nobody offered, and I had to reach out to somebody and say, hey, would you mind? I had to put myself in some of those vulnerable positions. There was one time my sister-in-law unexpectedly got sick and couldn't come with me to chemo. And it's not that I needed someone there with me, but it was really helpful. I had 8-hour chemo sessions. So it was really nice to have somebody with me. And, I called a friend who I would not normally put someone on the spot like that, but the night before asked her literally to not go to work next, if she could, to come with me. And she did it. And she was so, so thankful that I called her. So people want to help, but do it, in a way that, just you do what feels right to you.
I love that. I love that. And I think, especially as moms and caretakers, it's really hard for us to ask for help.
Right.
And, so we're overwhelmed, we're going through so much, but then that asking for help is like not even an option sometimes. So I'm glad that you are stressing on that, the importance of asking and receiving. Like, no, no, no,
Mhm.
we're fine, is what we
Right.
always say. Like, yeah, everything's
Exactly.
good.
And
And
sometimes you need to give people very specific things,
mm,
because like my sister, she's an hour and a half away. So it wasn't realistic. And she has 3 small children. It wasn't realistic to ask her to come up in an hour and a half and spend 8 hours with me. Would she have done it? I'm sure she would have figured out a way,
mm,
but it wasn't realistic. So, but
mm,
she's one of my best friends, right? And she was feeling very helpless in this situation. But she's also into fashion. And she's the first person I call to say, can I get away with wearing this top? Or does my hair look okay? So I said to her, you know what? I am feeling overwhelmed by all of these choices of these wigs, around the concept of losing my hair, around could you just take this list, call around, see what you think is the best option for me, and then come with me. And that's what we did. When I started losing a substantial amount, she went with me. We even found humor in some of it,
Mhm.
and she was able to participate in my treatment in that way, where I don't think she would have ever kind of inserted herself into that
Mhm.
situation, or even thought to offer, hey, could I help you find your new hair for the next year, So
Mhm.
just don't be afraid to be specific with your requests.
Mhm. It's great. Corinne, you have so much that you could say and so much to share. And I wish we could keep going and continue talking about this conversation. And I'm sure hopefully we can come back to this
Mhm.
because you have so much valuable things to share and so much insight in how mental health, spiritual health, physical health, and just overall confidence in yourself in that moment, listening to the inner voice was so helpful with your treatment and getting you through this. I am grateful for you. I'm grateful for your friendship, your kids. You're an amazing person. Your family is beautiful.
Thank you.
And thank you for taking time out of your workday and joining us and sharing how your mental health has, you know, kind of transformed through this journey of
Mhm.
breast cancer.
Right.
Thank you so much for your vulnerability and your time. Like the way
Thank
family, if you have
you.
any questions, any comments, reach out to us. We're here. And Corinne, I will make sure I get some notes from her on some of those support systems that she was mentioning just to help us and we can share those resources with you. Thank you
Absolutely.
so much.
Thanks, Erica.
Thank you,
Bye,
everyone.
everyone.